All right, welcome back to ABA exam review and the continuation of our BCBA practice question series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. A behavior analyst is beginning services with a 15-year-old client who has been court-ordered to receive ABA services following behavioral incidents at school. The adolescent refuses to participate and states they don't want services. The parents insist services must begin. What should the analyst do first? Now, this question lets us discuss a few key points about consent, assent, age, and how we can get services to start, who can deny services, that kind of thing. Now, to start, parents, or the primary stakeholders, I should say, the caregivers or parents, whoever's responsible directly for the client, of course, can deny services at any time. Now, when it comes to consent and assent, assent is for individuals under 18 or who can't provide their own consent. Informed consent or consent are for 18-year-olds and over, or the caregivers. So if we have a 15-year-old who says they don't want services, does that 15-year-old have the right to deny those services? No. They're not 18. They're not their primary guardian. Their parents are the one who gets to decide, do we have services, do we not? So even though the 15-year-old doesn't want them, it's not necessarily their choice. Now, in that case, do we just ignore the idea that we want to obtain some sort of assent or agreement from the client? No. So what does the analyst do first, given this information? Refuse services until the adolescent agrees to participate. If we refuse services until young clients agree to participate, we might never work, right? So just because the client, who is not 18, who is not a legal adult, who's not their own legal guardian, doesn't want services, doesn't mean we don't provide them. B, begin services immediately since parental consent is sufficient for minors. Now, that's one way to look at it, but we still have no agreement from this 15-year-old at all. And we must make at least the effort to get some sort of assent from the adolescent. So C, obtain informed consent from parents, seek assent from the adolescent. C is much more thorough than B, and it's much more by what the ethical guidelines say. Yes, the 15-year-old doesn't want services, but we still must try to at least obtain some sort of assent from them. And at that point, if they still don't want them and the parents give informed consent, we start anyway. D, begin services but only implement non-intrusive interventions until the adolescent agrees. We need to provide the best services possible for the 15-year-old. As long as these parents want them, as long as they've given informed consent, we can start. However, we still want to try, at least in the beginning, to seek assent from the adolescent. Full compliance is both consent from parents or caregivers and assent from the minor client. Jackson administers the motivation assessment scale and the questions about behavioral function for a client's aggressive behavior. The MAS suggests escape function while the QABF suggests attention function. What should Jackson conclude from this data? So this is a really easy question, but if you read it and think, well, I've never used the motivation assessment scale, I've never used the QABF, then you've fallen into the questions trap. The question's trying to distract you from the ultimate question of what Jackson can conclude from this data. When we use these scales and these ratings, and there's a million of them we use, what can we really draw from a scale, an interview, a survey? Well, think about what type of assessment that is. It's an indirect assessment. Do we ever make final decisions on indirect assessments? We don't. Even if other professions do, or may want to, as ABA providers, we never make final decisions based on indirect data such as scales. So regardless of if you know what these scales are or not, it doesn't matter. We know they're indirect, and therefore what should Jackson conclude? A, the escape function is correct since the MAS is more reliable. Well, that we don't have any clue about these scales, right? What's more reliable, what's Not. So A can't be the answer. B, the assessments are invalid and should not be used. Now, just because they're indirect and we're not going to trust them fully to make our decisions, doesn't mean they're invalid. They can provide very valuable information. C, both functions are present and should be addressed simultaneously. Possibly, right? The scales do suggest that. But before we do anything, what do we need to do? Well, D, indirect assessments provide useful preliminary information, but direct observation and our functional analysis are needed to clarify function. Absolutely. We can use these indirect assessments. They're good guidelines. They give good background information. But before we move forward, we've got to conduct some sort of direct observation and see these things for ourselves to make that ultimate decision. So what should Jackson conclude? Indirect assessments provide useful information, but we still have to directly observe. Tony receives authorization from an insurance company for 20 hours per week of ABA services for a client. After 2 months, Tony, a behavior analyst, determines that the client will benefit more from 15 hours per week based on current progress and skill development. What should Tony do? I like this question because even though it's short, it is very applicable to real life. As a BCBA, if you're working, especially in the autism community, in clinical and homework or house services that are provided by insurance and funded by insurance, you're going to run into the issue of how many hours per week, authorization for hours, we need more hours, we need less hours. And ultimately, your decision on how many hours a week somebody gets is not based on the max amount of funding, it's based on need. So just because Tony gets his authorization for 20 hours a week of ABA doesn't mean Tony should provide 20 hours a week of ABA. Now, the business side makes that difficult, right? Because, of course, 5 more hours means 5 more billables. But if the client could benefit more from 15 hours per week, we need to do what's best for the client. And this is really where ethics comes in, right? People find ethics boring. People find, what's the point of ethics, right? It's not that complicated. And it's not, but it's all about making the ethical decision, what's best for the client. Tony, if they're authorized 20 hours, but thinks the client could benefit 15 hours, well, what should Tony do? A, continue providing 20 hours per week since that's what was authorized. It doesn't matter if they're authorized 40 hours per week. We've got to do it based on need. And remember, if we take 5 hours away from this client, that's 5 hours another client may use or need. B, reduce to 15 hours per week and bill the insurance company for 15 hours. Absolutely. Go to 15 hours and only bill what you're providing. C, continue 20 hours but reduce the intensity of intervention during 5 hours. Again, what's the most benefit? 15 hours. Give what's going to benefit the client the most. D, reduce to 15 hours but bill for 20 hours since the authorization allows it. We definitely not. We don't want to bill for what we did not provide. Notice how we read every answer choice of every question, even though we determined before we even got to the answer choices that B was the right answer. We're doing this for a couple reasons. One, we want to know why the wrong answers are wrong. And two, we want to be complete and we want to make sure we're picking the best answer. In this case, do what's best for the client and only bill what you provided. This is the most ethical answer. A parent reports that their child's tantrums occur randomly and believes the child is just trying to be difficult. The behavior analyst conducts a functional assessment and identifies that tantrums consistently occur when preferred items are visible but out of reach. The behavior analyst's explanation best reflects what's philosophical assumption relative to the parent's report. Now, the key here is relative to the parent's report. So when we're choosing the philosophical assumption here, we want to take into account what the parent has said. The parent said, child tantrums occur randomly. They're just trying to be difficult. So that word randomly, do we ever think anything is random in ABA? No. Nothing just happens for no reason. We always think there is a reason. And what assumption says everything happens for a reason, the universe is lawful and orderly? Determinism. So if we're thinking about the behavior analyst who then conducts an assessment and says, well, no, the tantrums occur because this happens, preferred items are visible, how does that conflict with the parent's report? Well, the parent says it's happening randomly. There's no lawfulness. There's no order. The behavior analyst is saying, well, the universe is lawful and orderly. Things happen for a reason. So A, parsimony says what? Parsimony is going with the simplest explanation, right? We're not really necessarily talking about the simplest explanation. Maybe the simplest explanation would have said, well, it happens for no reason, right? That's pretty simple, but that's not what we're concluding. B, determinism. Yes, that's what we predicted. Notice how we're trying to predict the answer before the answer choices. Being deterministic, things happen for a reason. The universe is lawful and orderly. C, empiricism. Empiricism, we're using observable data to make decisions. Yes, the analyst did see or identify that tantrums occur when preferred items are visible based on their assessment. But we're looking relative to the parent's report, and so determinism is going to be more accurate. It's going to be a better answer. And D, philosophic doubt. Philosophic doubt is questioning that which is already believed. So always questioning or redoing or trying to reconfirm confirmed facts, essentially, right? In this case, the idea that the child's tantrums occurred randomly was never a fact. So the behavior analyst isn't necessarily doubting that, right? And again, it's better, the better answer is the behavior analyst is being deterministic relative to the parent's report, who was not. A toddler quickly withdraws their hand after touching a hot stove, learns over months to say please when requesting items after repeated reinforcement, and grows up in a country where making eye contact with elders is considered disrespectful, which they follow without direct instruction. These three examples best represent which levels of selection. So what are our levels of selection? We have phylogenetic, ontogenic, and cultural. Phylogenetic is years or decades or generations of evolution have taught us how to behave and have ingrained in us certain things. Ontogenic is learned history, so our own personal history. And cultural selection is learning from the people we're around, right, where we live. So let's look at a toddler quickly withdraws their hand after touching a hot stove. Why would they do that? Because pain. Pain is unconditioned. How does pain become unconditioned? Well, generation of generations before us, we've been biologically programmed to feel pain and avoid pain. So this is more of a phylogenetic response. What about learns over months to say please when requesting items after repeated reinforcement? So if we're learning over months to do something, and this is their own personal history, that's going to be ontogenic. And then grows up in a country where making eye contact with elders is considered disrespectful. So this is about their environment, their surroundings. This is cultural. So the pain is phylogenec. The learning and the own personal history is ontogenic. And growing up in the environment is cultural. Not a hard question. A good refresher, though, for these three types of selection. Make sure you know the difference between these three. All right, thanks for watching. Check out behavioranalyststudy.com for all of our study materials. When you pass your exam, let us know so we can include you in the Sunday shout-out. Work hard, study hard. See you soon.